I want to share with you 4 tests that you need to ask your doctor to order on you. There's many more that we run at our practice, Vitality Renewal, to get a complete picture of where your health is. But these 4 are really important and I think should be part of the screening exam that you have once a year. First, please ask for a vitamin D level, and the name of the test is 25-hydroxy vitamin D, 25-OHD. Vitamin D is an incredibly important micronutrient. Your body can make it out of cholesterol when ultraviolet rays from the sun hit your skin. However, the issue is we wear sunscreen because we don't want wrinkles or skin cancer, and that blocks the ultraviolet rays that make vitamin D. Plus, when you think about it, most of us are indoors most of the day. If we're outside in the summer, then it's at the morning when the sun is rising or the evening when the sun is setting, before or after work, and that's not when we're going to get the rays necessary to make vitamin D. Vitamin D is important for bone health. It's important for your immune system. In fact, there was studies that came out during COVID that showed people who had a vitamin D level greater than 50, their risk of death from COVID was 0. That never made the news. Another thing that vitamin D does is it helps your steroid hormones work. Cortisol, progesterone, estrogen, testosterone. Those hormones cannot work unless vitamin D is present with them. The reference range on your lab is typically 30 to 100, but optimum is 60 to 100. This is where we get into the difference between a 90 percentile, where most of the population lies, and optimum. 60 to 100 is where you want it, not in the 30 to 60 range. Next, vitamin B12. Crucial vitamin. It's not in a lot of foods that we eat. It's in organ meat. It's a little bit in eggs, but I don't know people who eat a lot of organ meat. And if you're a vegetarian or a vegan, it's really hard to get enough vitamin B12. Vitamin B12 is important for your nerve function. If you have low B12, you might have numbness and tingling in your hands and feet. It's important for your metabolism. It's important for your brain, your mood. So people with low B12 are often depressed. It's also important for how your body detoxifies and gets rid of things. It's important in what we call the methylation cycle, which is important for how we detoxify estrogen and other things that we're exposed to. The optimal range for vitamin B12 is 700 to 900, and normal range goes down to like 245. That is just crazy. Most traditional neurologists, if they find a level less than 400, they recommend injections to get the dose up immediately because of the neurologic symptoms that go along with low B12. Now, here's the thing though. If you're going to take B12, please don't take B12 that has cyanide in it. The most common form of B12 in nutritional supplements, multivitamins, and unfortunately, even in doctors' offices that prescribe B12 injections, is a form called cyanocobalamin, and that is B12 attached to a cyanide molecule. Okay, well, I don't know about you, but I prefer no cyanide with my multivitamins. It's kind of crazy. I challenge you to look this up on the internet and ask, is cyanocobalamin harmful? And what you'll find is that it will say, yes, there's cyanide in this form of B12, but it's not considered enough to be truly toxic. Yeah, it's not going to kill you, but don't we take vitamins to be optimally healthy? So why do we want to have any toxins with our vitamins? Use methylcobalamin or hydroxycobalamin. Don't use cyanocobalamin. Okay, test number 3 is a red blood cell magnesium level. Crucial that it's a red blood cell magnesium and not a serum magnesium. Inside your cells is where magnesium is used, not in your bloodstream. And there's a huge difference between the concentration in your bloodstream and the concentration in your cells. If you're low on magnesium, your body will keep it in the range inside the blood, in the serum, because it's crucial electrolyte, but then your cells will be even lower. Now, why is magnesium important? Magnesium is like the hammer. You try to build a house without a hammer, you're not going to get very far. It's the most commonly used tool in the toolbox of your body's cellular functions. It's a cofactor for over 300 enzymes, which are your workhorses that get the intracellular job done. It's also important for muscle relaxation. So people with low magnesium will have leg cramps and anxiety. The optimal range for magnesium, red blood cell magnesium, is 5.4 to 6.4. Normal range goes all the way down to 4. That's not enough. And lastly, please check for an ANA. This is a test. It's called Antinuclear Antibody, and it's not run as a routine screen, but I think it's a super important test. If it's negative, I may not run every year. I will run like every other year. But if it's positive, it's a red flag. That means that you have immune system dysfunction and your immune system has started to attack your nuclear material, which is your genetics, your DNA, which is supposed to be buried deep inside your cell in the nucleus and protected. So if it's exposed to your immune system and you've built anti-nuclear antibodies and you got a lot of cellular damage from toxic exposures, and it's going to affect your entire health. It's going to affect how your hormones work. It's going to affect how your energy works. It is so important. And the studies show that if you have a positive ANA, you are at much higher risk over the next 10 years of developing a frank autoimmune disease. Now, what do I mean by that? If you get a positive ANA, your primary care doctor will most likely send you to a rheumatologist because it's a marker for autoimmune disease. And then your rheumatologist is going to ask you a lot of questions. Do you have this symptom? Do you have that symptom? They may run a couple other tests to make sure that your liver is not damaged. And then if they don't find anything that's end organ damage, typically what the rheumatologist will say is, okay, well, yes, you have immune system dysfunction, but you don't have autoimmune disease. So there's really nothing I can do for you. Come back to me when you feel worse, and then we'll put you on immune suppressing medicines. He or she doesn't quite say it like that. But I have met so many people that have told me that they did go to a rheumatologist, referred by their primary care doctor, and were told something along those lines. That is a tragedy. And the reason that they're told that, though, is because in the traditional medicine paradigm, they don't believe that it's reversible. But I have seen these ANA titers go from positive to negative in multiple patients who follow the protocols and get their life in order and get their health optimized. Let's see if we can prevent autoimmune disease. But in order to know, we need to know if you have the red flag of the immune system dysfunction. So there you have it. There's 4 tests to ask your doctor for. If they don't order them because they say they're not indicated, you might need to find another doctor. Be your own advocate. Learn what's important. And if you need help, we're just a phone call away at Vitality Renewal, or find a functional medicine doctor near you.